Welcome to the Scenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome back to the Deep Dive. Lots of people are looking for, more natural ways to manage mental wellness these days.
Absolutely. It's a huge area of interest.
And today we're really getting into one of the big names you hear about, St. John's wort.
Right. Hypericum perforatum. It's a flowering plant, been used for, centuries, really. But now we're seeing actual clinical trials.
So our mission today is to kind of cut through maybe some of the noise, get down to the facts people need.
Exactly. What does it actually do according to the science? What's the right way to take it? And crucially, what are the safety warnings? Because those are really important here.
Yeah, this feels like one where knowing the details isn't just interesting. It's about being safe and getting results, right?
Definitely. The stakes feel a bit higher with something that has real biological effects.
Okay, so let's start with the basics. You mentioned mood support, but where does St. John's wort actually fit in, according to the research?
Okay, so the sources are pretty clear on this. It's got solid clinical backing, specifically for mild to moderate depression.
Mild to moderate. That seems like a really critical distinction right off the bat.
It absolutely is. If someone's dealing with severe depression, the consensus is, well, this isn't the right tool. It's just not considered strong enough for that level.
So knowing that boundary is step one.
Definitely. But what's pretty fascinating is how well it seems to perform within that specific area.
What do you mean?
Well, several studies actually show that for that mild to moderate range, St. John's wort can be, get this, just as effective as some standard prescription antidepressants.
Wow, okay. As effective. For a natural supplement, that's pretty significant.
It really is. It surprised a lot of people in the medical community, I think.
So that raises the question then. If it can be just as good for milder cases, why isn't it like the first thing doctors suggest? What's the catch?
Yeah, good question. There are a couple of big factors. First one is time.
Time.
Yeah, the waiting game. Like a lot of medications, actually, it doesn't work instantly. You need to take it consistently for, say, 2 to 4 weeks before you really feel the full benefit.
Ah, okay. So patience is required. People might give up too soon.
Exactly. That happens a lot with supplements. People expect instant results, and, well, it doesn't work like that.
Okay,
Yeah.
that makes sense. And what's the other factor? You mentioned a couple.
The other big one, and we'll definitely dig into this more, is quality. With a prescription, you know exactly what you're getting. With supplements, it's not always so clear-cut.
Right, the Wild West of the supplement aisle.
Yeah.
But let's stick with using it effectively for a second. Consistency, you said. That leads right into dosage, doesn't it?
Precisely. Because it's over the counter, people might think they can just, take whatever feels right. But the research points to a very specific amount for effectiveness.
And what is that number?
The dosage that comes up again and again in the studies that showed positive results is 900 milligrams per day.
900 milligrams total per day. Is that all at once?
Generally, no. The standard way is to split that up. Typically, it's 3 separate doses of 300 milligrams each, spread through the day.
Okay, so 300 milligrams 3 times a day. Why split it up?
It helps keep a more consistent level of the active compounds in your system. And there's another tip that came out of the studies.
Yeah.
Take it with meals. It seems to help with absorption, and it can also cut down on potential stomach upset, which some people do experience.
Okay, with meals. Good practical tip. Now, I saw in some of the deeper research, they tested higher doses, like up to 1,800 milligrams. Is more better here.
It's logical to think that, but the research actually concluded the opposite.
Really?
Yeah. Going above that 900 milligrams a day didn't really seem to make it work any better for depression symptoms. But what it did do was significantly bump up the risk of side effects.
Okay. So diminishing returns and increasing risk.
Exactly. So sticking to that 900 milligrams daily total seems to be the sweet spot based on the evidence. Don't push past it thinking you'll get more benefit.
That brings us right back to that quality control issue you mentioned. If the dose is so specific, how do you even know if the bottle you buy actually has that 900 milligrams of the right stuff?
Yeah, this is where you, the listener, have to become a bit of a detective when you're shopping. It's all about standardization.
Standardization. What exactly should people look for on the label?
The key phrase is standardized to contain 0.3% hypericin.
Hypericin. Okay, let's pause there. What is hypericin and why is that 0.3% number So critical.
So hypericin is thought to be one of the main active chemical compounds in St. John's wort. It's the part we think is actually doing the work on, brain chemistry to help with mood.
Kind of like the engine in the car.
Good analogy, yeah. And the standardization part. Well, the amount of hypericin in the raw St. John's wort plant can be all over the place. It depends on where it grew, the soil, harvest time, lots of things.
So one batch might be really weak, another potentially too strong if you just ground up the plant.
Exactly right. It made it really hard to study reliably at first. So scientists figured out they needed a consistent amount of the active ingredient. That 0.3% hypericin level is the one that was used in the studies that showed it worked.
So if the bottle doesn't say standardized to 0.3% hypericin,
then you honestly have no idea what you're getting. It could be ineffective, basically just dried plant powder. You really need to look for reputable brands that clearly state that percentage.
that's a really crucial piece of information. It moves it from just like general herbalism to something needing almost pharmaceutical precision from the consumer.
It really does. Okay, so we've covered effectiveness, the right dose, the quality marker. Now we absolutely have to talk about the limitations and the safety side.
Right. Let's start with what it doesn't do well. Any common mix-ups there?
Yeah, a big one is anxiety, because it helps mood. Some people think, oh, maybe it's good for anxiety too. But the authoritative sources, they really caution against that.
Why?
The evidence just isn't there. It seems its main strength is really specifically for that mild to moderate depression. Using it for anxiety disorders doesn't have much, if any, scientific backing.
Okay, so manage expectations there. What about specific groups of people, like kids or teenagers?
That's another area for caution. The data on using it in children or adolescents is very limited. We just don't have enough strong studies.
So not recommended generally.
It really has to be guided by a healthcare professional. They'd need to weigh the potential risks and benefits very carefully, given the lack of solid evidence. It's definitely not something to try on your own with a child.
Understood. Okay, let's talk side effects. If someone starts taking the standard 900 milligram dose, what might they experience besides maybe that stomach upset?
The most commonly reported one is photosensitivity.
Photosensitivity.
Yeah.
Meaning you get sunburned more easily.
Yes, but potentially quite a bit more easily. Your skin becomes significantly more sensitive to sunlight.
So we're not talking just a little pinkness. This could be serious sunburn.
It definitely could be. It substantially increases your risk. So if you're taking St. John's wort, you absolutely need to be serious about sun protection. Hats, long sleeves, high SPF sunscreen.
Maybe avoiding midday sun altogether.
That would be wise, yeah. You really have to adjust your habits around sun exposure. It's not a minor thing for some people.
Okay, photosensitivity is a big one. Anything else common?
Some people report feeling a bit restless or agitated sometimes. And paradoxically, some people actually feel fatigued.
Interesting mix. Okay, those are the more common ones. But you mentioned serious safety warnings earlier. What's the absolute biggest red flag people need to know about? The thing that requires talking to a doctor before starting.
This is the absolute critical point. Drug interactions. It cannot be stressed enough.
Okay. Interactions with what?
A lot of things, unfortunately. St. John's wort affects liver enzymes, specifically one called CYP3A4, which is responsible for breaking down many, many medications.
So it messes with how your body processes other drugs.
Exactly. It can make them less effective, or sometimes build up to dangerous levels. We're talking about things like birth control pills.
Oh, wow. Okay. That's important.
Yeah, blood thinners like warfarin, drugs taken after organ transplants to prevent rejection, some HIV medications, some heart medications, and critically, other antidepressants.
So taking it with a prescription antidepressant is a major issue.
A potentially very dangerous issue. It leads to the risk of something called serotonin syndrome.
Serotonin syndrome, what is that?
Okay, so St. John's wort works, we think, partly by increasing serotonin in the brain. Many prescription antidepressants, like SSRIs, do the same thing.
So you're doubling down on the serotonin boost.
Precisely. And too much serotonin is actually toxic. It can cause a serious, potentially life-threatening reaction.
What does that look like? What are the symptoms?
You're looking at things like confusion, agitation, really rapid heart rate, sweating, muscle rigidity or twitching, high blood pressure. It can escalate quickly. It's a medical emergency.
Wow. Okay. So the bottom line is, if you are taking any other medication at all,
or even other supplements, really,
you absolutely must talk to your doctor or pharmacist before even considering St. John's wort.
Non-negotiable. It's the only way to be safe and check for those potential interactions.
That is a very powerful warning. Okay, let's try to bring all these threads together then. We have the 900 milligram dose, the 0.3% hypericin standard, the fact it works for mild to moderate depression, but this huge interaction risk. How does someone weigh this against, say, just getting a standard prescription?
It kind of clarifies the picture, doesn't it? St. John's wort emerges as a viable, science-backed option if you have mild to moderate depression, if you're not taking interacting medications, and if you're diligent about finding a quality, standardized product and sticking to the right dose.
A lot of ifs.
Yes. Prescription meds, on the other hand, might be faster, more reliable for more severe cases, or the only safe option if you are on other necessary medications. Both approaches have potential side effects, of course, but St. John's wort puts a lot more responsibility on the user for ensuring safety and effectiveness through quality control and interaction checks.
It's fascinating, isn't it, that this ancient herbal remedy really needs modern scientific discipline. The exact dose, the specific chemical standardization, the awareness of drug interactions to be used well.
That's really the core message, I think. It's a natural product, yes, but it demands a level of precision you'd associate with pharmaceuticals to be both effective and safe.
You can't just be casual about it.
Absolutely not. Informed caution is essential. It's not something to just grab off the shelf and try without doing your homework and ideally talking to a professional.
So, as we wrap up this deep dive, the final thought here seems to be about navigating this complexity carefully.
Exactly. It's this interesting place where traditional knowledge meets modern science, right? There's real potential in exploring natural remedies for mental health, definitely.
Yeah.
But the absolute key, the safety net, has to be professional clinical guidance. A doctor or a qualified healthcare provider is the one who can look at your specific health picture, your other meds, the severity of your symptoms, and help determine if St. John's wort is truly a safe and appropriate choice for you.
So don't skip that step.
Please don't. Make that consultation the final, necessary check before starting. It's the crucial step to using this powerful plant wisely.
Thanks for tuning in to the Scenario Podcast. Don't forget to visit scenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.